Oh, hi, everyone. Welcome to the Solo Parenting Podcast. I'm your host, Jennifer Gill, and I've got another amazing guest today. She is a pediatrician, and she's all based in UK. So we're going to be talking about her specialty and how she's liking her job and how she's treating her patients, which are children, or pediatricians. So I'm really looking forward to this. Let's find this amazing. Anyway, stick to the at the end, and I'll have a special present gift for you. Also, if you're interested in purchasing my solo parenting guidebook, it's available on Amazon, or you can purchase it from me. You can just connect with me at jennifergale68@gmail.com and just be a couple more minutes and I should have the guests come on. So hang tight. Okay, welcome everybody. My special guest today is a pediatrician. Let me introduce you to her. Her name is Dr. Inyang Takon. Welcome, Dr. Takon. How are you?
I'm fine, Jennifer. Thank you. How are you?
I'm doing well. Thank you.
Good. Good. Thank you for inviting me to your podcast and well done for the great job you're doing.
Thank you. Thank you.
Good.
So I'm going to just get you to go ahead and let our audience know what topic you kind of specialize in, what you kind of normalize around the pediatrician as a role for.
Okay. Thank you very much. So, hi, everyone. Hope you're having a nice summer and it's not too warm out there. Good. So, I'm based here in the UK. We've had hot weather today. So, it's good and bad. But lovely to be with you all. So I'm a pediatrician practicing in the United Kingdom, and I've been a pediatrician for in pediatrics for over 30 years, and I've been a consultant in my specialist field for over 20 years. So I started off doing general pediatrics and then focused on neurology in a bit, and then decided that I had interest in neurodevelopmental disorders. So I've been doing this for the past 20 years. So the range of children I see children from 0 to 18, but I see children with disorders, neurodevelopmental disorders or neurodiversity, which includes conditions like ADHD, autism spectrum disorder, tic disorders, fetal alcohol spectrum disorders, children with developmental coordination disorder, or what we know as dyspraxia, and I also see children with epilepsy. So I am also a pediatrician with specialist interest in epilepsy. And I find my job very interesting, really interesting, because I think it's the greatest thing to work with children where you can work with them for a long time. So I see a lot of the children I see stay with me until they get onto adulthood, until they're going into adulthood. So I have the opportunity of actually being part of my parents and children's lives until they get to adulthood, which is an amazing thing because you're there with the highs and the lows.
Yeah.
You're an advocate for the parents and the child. You support them through battles that they get through, because it can be challenging and trying to navigate the complexities of the child's difficulties before diagnosis and through different things which they have to get through. So it can be a very challenging road, which is, which I'll talk about later, led me to start the podcast that I run because I felt that there was a need to empower families, empower parents, empower children as well.
Yeah.
So what led me to neurodevelopmental disorders? So as I said, I was a pediatrician in the hospital seeing very sick children, and then we treat them and they go home. But then somehow I felt you may never see that same child again, or you never know what happens to them long term because you're just treating acute illnesses and all that.
Yep.
And then I started understanding later on. So when I came over to the UK, over almost 30 years now, when I came over and started studying my field, I was actually very interested in how the brain impacts on behaviors, how behaviors that you see
Mhm.
have, a lot of them have an origin. There's a reason why a child is behaving in the way they do.
Mhm.
And so it was quite fascinating that, you know, people did not, a lot of people did not really understand. And because of that, families could sometimes face a lot of um being judged, really. Like, you're going out with your child, and your child is, maybe having a tantrum or being distressed, and people automatically look at you as you're a bad parent. Why can't you control your child? And you're doing everything you can to try and keep the child calm and quiet, but the child is so distressed and screaming, and what was supposed to be maybe a happy shopping experience for you or a nice day out becomes a very distressful day. But no, everybody is looking at you and saying, why is that child screaming? Why can't that parent keep that child? And I have seen this happen a few times, and the looks the families get when this happens. So when I started studying more of this, I became very interested in how behaviors, patterns of behaviors can explain the way children behave, and how there were different factors that could result in those patterns of behavior.
Mhm.
So when I was seeing, I did my undergraduate medical degree in Africa. And when we were seeing lots of sick children from different causes, like infections or birth trauma, we would treat them and they would go home, and we would not know what happened to them again. Now, some of those children, as they grew up, their development, because of the difficulties they had had at birth,
Mhm.
obviously a lot of those children were affected because of those things and started displaying some of those challenging behaviors, but people never saw them again, and the families never could relate that what happened at birth could have explained some of the behaviors the child had. And
Mhm.
so people around them did not understand, and nobody would know how to support the children. So it then became clear that actually there was
Mhm.
a lot to learn about these conditions, which is what made me specialize and learn more about neurodevelopmental disorders. And I went further to do further master's training in developmental disorders and clinical neuropsychiatry. So I went and got further academic experience on top of my clinical experience. And I've been keeping abreast with the research in this field. I've presented in different conferences internationally in North America, in UK and Africa and the Middle East, and I have been involved in teaching. I've delivered teaching in
Mhm.
outside as well, because I just felt that it's so important understanding this condition. So going back to the job, so the discussion about neurodiversity, and we look at it from the child's point of view, we look at it from the parent's point of view. If you look at it from the child's point of view, so just imagine a child who has had all these difficulties now trying to fit into the usual society, which hasn't made any adaptations, doesn't understand them, and how that child reacts. So you get a child, for example, let's take an example, a child who has sensory difficulties. That child may be very anxious, and that child may possibly have autism. That child, prior to diagnosis, that child gets out of the house, bombarded by lots of noises, gets onto the transport. If it's a public transport, the world is very busy out there. The noise, the lights, everything, the number of people around. is just making the child really distressed. So what parents might think, oh, I'm going to give you a good day. Let's go to the fireworks. Let's go to a busy park. Let's go to, let's go and have fun. Might
Mhm,
end up being a nightmare for the child because the child is being exposed to a lot of sensory overload. And
mhm,
what happens when the child is in sensory overload? The child wants to run away. The
mhm,
child screams because the only way they can communicate their distress to parents is to cry, is to scream, is to show that they don't want to be there. And the reason they don't want to be there is because all those things are overwhelming them.
mhm,
That same child may also struggle with interacting with other people. And then you see people coming to the child, everybody's touching the child. Child probably doesn't like people touching them. The child is being presented with a lot of things that the child doesn't like. So if you think of this as one example of what the child faces on a day-to-day basis. So
mhm,
sometimes the child might actually refuse going to school, and parents might have a lot of difficulty getting the child to school. And the reason the child refuses to go to school is many reasons. They don't like being there because
mhm,
they remember that that's the place where there's so much noise, it's so uncomfortable, it's just awful. They're seeing things changing, they don't know what's going to happen. And
mhm,
so the only way they can protest that is to refuse to go to school. So parents now battle with school refusal. They battle with can't get the child out of the house. They battle with can't leave the house and go to these places. And
mhm,
all this might be happening without the child, without the family actually knowing what's going on. On the other hand, as well, that child may be one that wants to eat the same food all the time or may struggle to eat food, and the parents are at their wits' end because they just can't explain why the child would only eat probably chips from a particular shop
mhm,
or have only two or three things that they want to eat and don't like, say, wet foods, don't want their foods mixing up.
mhm.
Um, on the parents would be trying their utmost best to try and get the child to eat. So you can imagine the challenges of day to day, what the parents are going through trying to manage and understand their child. And then when they get outside, they're having all the criticisms from everywhere, everybody. And if this parent is a working parent, they
Mhm,
probably have a job. They're having to make excuses all the time. Oh, the nursery has called me out. I have to go to my child's school and pick them up. Suddenly, the bosses might be feeling, why is it always you? Can't you sort your child out?
yeah,
And so that is why we say it's so important to get the child assessed.
mhm,
If you find that there are patterns of behaviors that your child is displaying, which is causing so much difficulty for the child to interact in school, or for you as a parent to parent the child, or to actually do things where you feel it seems like extreme hard work for you to parent the child,
yeah,
then it is very important that you seek help and see the doctor for an assessment. Because what does assessment do? Assessments help with understanding the child's profile. And if the child then meets one of the diagnoses, then there are ways in which that child can be supported. The people at school will then be able to understand what kind of things need to be adjusted for the child to be able to stay in school. So you can go from a very unhappy child without a diagnosis to a happier child with a diagnosis who is well supported at school because the environment has been made more suitable for them at school to function. And so that is why neurodiversity is it's important for people to understand. Now, moving out again, you still have the siblings at home. So if that child has siblings, the child's siblings might feel, why is X having preferential treatment than me? Sometimes The parent may be completely absorbed in looking after the child with difficulties and almost not think about, not think about, but almost not, give the same level of attention to the other children. So it's important for us to be very sensitive to that the other children in the home have needs, and also having ways of explaining to the other children what might be going on with their sibling, because when you involve them in that discussion, they're more likely to understand and actually be a party to helping to solve the problems as well.
Okay.
So that's and then coming to the school, sometimes not every teacher understands neurodiversity. Not every school personnel understands neurodiversity. And that is because I don't know about Canada, but in the UK, it's not something that is taught in the curriculum. At least now they're trying to modify that. The curriculum is being modified now, but in the past, a lot of teachers did not know anything about this. So teachers would see that they have to deal with every behavior
Yeah.
in the same way. A defiant child um, was met with a lot of strictness and punishment,
Hmm.
whereas that defiant child may not be defiant, may just be a child with their own opinion and rigid views, which can happen in some of the neurodiverse conditions like autism. So, children who've got autism can be very rigid and not flexible. They see things in one way, and if it doesn't go the way they want, they will not do it. And somebody can read that as being rude or disobedient. That child in class might just say things that is on their mind,
Hmm.
and the teachers would think they were rude. And so we found lots of children with neurodiversity were sometimes being punished unnecessarily, were being excluded from school unnecessarily. And this caused a lot of distress. So, apart from the families understanding, it's also the fact that there needs to be a lot of education in schools about teachers recognizing the behavioral patterns early,
Yeah.
because teachers actually have the advantage of having so many children in the class at the same time,
Yeah.
so they can see differences in behavior, and they can see when a child's behavior is standing out or different from what is expected. But it's important that teachers understand. So one of the common things that happen in my clinic is I'm constantly having to write to teachers who punish children for things that are just part of their symptoms. So for example, a child may have ADHD and struggle to sit down or listen or be restless, and then they will get detentions for disrupting the class, or detentions for getting off their seat, detentions for not sitting down. Well, how can you punish the person, how can you punish the child for
Yeah.
a condition they have? It's just like punishing somebody with diabetes and hypertension for
Yeah.
having raised blood sugar, or raised blood pressure. So we
Yeah.
try to educate the teachers to understand the symptoms and look at other ways that they can support children instead of punishing them, and which is quite important. So I see different conditions. Then when it gets to the older child, so sometimes the younger children have not been diagnosed and they continue to have difficulties. How and what can that difficulty present with? You can present with a very unhappy child, a child who's not happy in the school. They might develop significant anxiety. Some of them might even become depressed because they don't like being at school. Some
Hmm.
of them have gone on and done things like self-harming behaviors because they don't want to be there, and they just feel that they're constantly being taken back to the school when they don't want to be at school. Some of them have run out of school. And if you think about how challenging this can be for
Yeah.
the parents, because they are trying their best to support the child,
Hmm.
but they are unable to. So if that child misses out
Hmm.
on being diagnosed in primary school,
Mm-hmm.
things can get a lot worse when they get to secondary school.
Mm-hmm.
The reason being that when children are in primary school, they've got a one form classroom. So everything happens within that class. And I presume it's probably the same in Canada as well. You know, that in year one, they move from year one to year two, they're not having multiple classes. When they get to secondary school, they
Mm-hmm.
have different classes for different subjects.
Yep.
Suddenly, a child moves from a smaller school to a bigger school,
Yep.
and that bigger school, they have a lot more subjects. They have to go to so many classes. They have to do a lot of things on their own.
Yep.
They have to remember that this period I have to be here, this period I have to be here, and that can be so overwhelming for children. So sometimes we find that children who had tried to manage in primary school suddenly get to secondary school and they're completely overwhelmed,
Mm-hmm.
and then they stop going to school. They become more withdrawn,
Mm-hmm.
and that can be really difficult. Some children can become easily led and be led to doing the wrong things and join the wrong, because they do things sometimes because they want to fit in with their peers, so they
Mm-hmm.
will go ahead and do things that their peers have suggested to them without that being the right thing. And that can really be quite difficult. It can be, um, we've had children, unfortunately, being exploited
Oh
by,
wow.
yeah, we've had children who've been exploited. We've had children who've actually been, um, you know, even sexually exploited or lured away by gangs, drug gangs,
Oh yikes.
and sorry, can you hear me?
Yep, I can.
Yeah, because they're so suggestible, and it's so easy for them, people to ask them to do things, and they readily do that because they can't think about, is it wrong? They get led, they want to fit in, and they might have friends who are already doing it, and they might be, unfortunately, the ones that get caught. So we've had lots of children end up in the criminal justice system because they've been so, um, impulsive and so easily led, that and the adults there, sadly, who exploit these
Oh
children. And we've had that. There's a quite a lot of issues with county line gangs and exploitation in the community. So these are things that parents might not be aware of until quite late,
yeah.
because parents might not actually understand what's going on, and if they don't know what type of friends the child is hanging around, and knowing that their young person can be quite vulnerable and easily led, these are the kind of things that can happen to neurodiverse children. Sadly, it does happen quite frequently, and we do see this happening. So we've had young people involved in drugs and alcohol, where, and then been used as conduits to buy the drug. And it's quite sad, very, very sad stories have come out of this. So that is one of the reasons why we stress a lot of early intervention, early recognition of the patterns of behavior, early diagnosis, and early support, because you can avert a lot of these things by doing things early. When you don't know what the child has, then the child becomes very vulnerable.
Mm-hmm.
And we've had very, very sad stories that have happened.
Oh wow.
Yeah. So, so it is quite tough. So in terms of, the range of conditions, I say the consequences of not diagnosing early can be quite tragic. Not only those children do not meet their potential, not only do they not, we have so many bright children, so many children with extreme gifts,
Yep.
fantastic gifts, in the, we've got fantastic artists, fantastic, they've got skills, but because they can't settle,
Yeah.
those skills have not been able to be used properly, and many of them, when they get excluded from school, so it's for schools that don't understand their behaviors, they exclude them because they refer to them as naughty.
Yeah.
And when you exclude them,
Hmm.
then what happens? You even put them at more risk of being out there in the community and being exposed to those type of things that we've talked about, the drugs and alcohol and all the, the horrible things that could happen. So, like I said, sadly, we've got quite a number of young people in the criminal justice system now, and um, recognizing, diagnosing is a way to go. There are lots of barriers. People ask lots of questions. People think, oh, I don't want to label my child. I don't want my child to have a label. How
Hmm.
is this going to affect them when they grow up having this label? Will they fit into society with this label? Will they get a job? Will they be able to function? And the answer to that is they can do anything they want to do. So when an assessment is done, part
Hmm.
of that assessment looks at your child's functioning, looks at what are your child's strengths. So I'm very keen on emphasizing strengths as a key feature,
Hmm.
because when we start from the point of the negatives, we forget what that child does really well. And so a lot of children, in fact, almost all the children I see, have something that they are very good at.
Hmm.
It's just that the quote negative part of the behavioral challenges, which people don't understand, is seen as the biggest factor, and people do not realize that this child's strength should be nurtured. So it's so important that you know people do, so these barriers are there, and some of these things have been from family circles where people in the family have said, oh, for we've had families where they've talked about it with their parents, who have talked about it with extended family and family members, and they say, oh no, I don't believe in that. No, no, no.
Hmm.
That child is just naughty, and a little bit more discipline will get that out of them. Oh no, 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 they will grow out of it. So more discipline, does not get that out of them. If the child's got neurodiversity, there are different strategies for managing them. And so, no matter how much discipline that you use, if you don't use the right strategies to support them, you're not going to get the results. And what happens sometimes, parents get really frustrated with the child, they're unhappy, and it has resulted in conflicts, sadly, between parents when this happens. So, because there's disagreements between both parents, thinking, no, 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 you're making this up. No, 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 it's a real condition. The other one is saying, no, it's not a real condition. I don't believe in this. And we see that fairly often. And these are some of the challenges we have to deal with fairly often in the clinic.
Hmm.
And the other part is, oh no, he'll grow out of it. No, he won't grow out of it, because people don't tend to just grow out of these things. Yes, the symptoms may modify. So
Yeah.
the child who was hyperactive and running around when they were younger might be, as a teenager, might be physically calmer, but doesn't mean that they're not still hyperactive, because what happens is they're not physically running around, but their mind is running around. Their mind is absolutely restless. And that's why they're thinking of all the things that they shouldn't be thinking about,
Hmm.
because all that physical bit that was happening to the body goes to the mind. And so they don't grow out of it. If you don't do something about it,
Yeah.
then it's going to go out of hand. And just to say that a lot of the neurodiverse conditions are heritable. So, which means when part of what we do is when we are assessing people, we ask about family history. And when
Okay.
we take family history, it's very likely that one person in the family had those behaviors. It's just that at that time, people
Mhm.
did not understand those conditions, so they couldn't put a name to it. And so, for example, Jennifer, I'm sure if you, I've looked up people down my family line, and
Yep.
I say to myself, "Oh, that's why that uncle was behaving that way. We thought he was just weird." Some people have called them, "Oh, he's a queer family member. He's quite queer. He has, he behaves queerly." That was what
Yep.
the people used to say. So if you think back, there are family members um, that would people would have been called, "Oh, he's crazy. He's erratic. He's this. He's that." Where people did not know about those conditions. So we gave them names.
Yeah.
We described them in the way that we felt, but now people understand the conditions more and they assess properly. But what happens is when you're doing assessments, you find that quite a number of the children, of the parents who bring their children, may recognize some of the traits in them.
Yep.
And some of them would now tell you, "Oh, I've struggled so much as a child. This was what I was like. I could never stay in class. I was always kicked out of class. I
Mhm.
couldn't keep still. I still, and then when as an adult, I couldn't hold a job down for XYZ." And sometimes some of those parents, when their child has been diagnosed, they have recognized the symptoms in themselves and they've gone over to get an assessment done. And some of them have had diagnoses. And for the ones that require treatment, like ADHD, they have been treated and they have functioned better. And they've had a better relationship with their child as well. So a lot of these conditions are heritable. So it's always worth thinking, is there anybody in the family with parents or aunties and all that that have similar traits?
Wow.
So it's always important to think about that.
Okay.
And so other mates, you know, so I do find, especially some of our people from strong faith communities, sometimes the faith communities discourage them from going to get assessments and
Yeah.
saying, "No, this is not possible,
Yeah.
this is not in line with your faith, you should just believe that he's healed." And they give them all kinds of explanations,
Yeah.
and we've had to deal with that because we've had to try and walk around that. And so a lot of people, um, I've had I've had to have discussions with people, and I'm trying to get through to the faith communities as well, to try and educate them to support people who have difficulties. If you think about it, a lot of the churches also have children's groups,
Yeah.
and the same children will be in the group.
Yeah.
So I had someone tell me recently, she's got a neurodiverse child, she has two. Had
Mhm.
someone tell me recently that one of the places that she struggled to go to with her children was a church,
Oh.
because they were not tolerant when the children were you know behaving or being active or couldn't sit still. They were looking at her in awkward ways. And even when she went to the Sunday school, to the children's school, sometimes she goes and the child will be in a corner because
Oh.
they felt the child has been disruptive,
Yeah.
has not been sitting still. So
Yeah.
they put the child in a corner. So there are all these things that we have to educate and break the stereotypes so that people can come forth and get the assessments that they need, and
Mhm.
so that the families can be supported. So why the child will be distressed in the church, because if you think about it, there's lots of loud music and
Yeah.
drums and things going on in church,
Yeah.
and there's a lot of running around even in the children's church. But what can you do? You can create a sensory space for that child within church. You can get the toys that they like playing with. You can create activities that the child will enjoy, within that and still be able to participate within the church. So, these are some of the barriers that prevents families coming forward from getting an assessment. So I just want to reassure everyone today that, you know, neurodiversity is not a disease. It's just explaining the different way in which, people see the world and how they respond to the world around them. And that seeing the world and responding is based on a lot of wiring in our brains. Our brains are wired differently. Sometimes some people's brains are wired in such a way that certain things, they're averse to it and they can't tolerate certain things. And when you understand that, then you won't be presenting them with those things that they struggle to cope with or
Mhm.
tolerate. You won't be doing that. So it's important that, families are empowered to seek help. If
Mhm.
you notice patterns of behavior in
Mhm.
your child that is preventing that child from accessing school, accessing activities, social activities, and things, then it's important that you seek help. And by seeking help, you seek help to see a pediatrician, particularly one who is experienced in neurodevelopmental disorders, and you get information from your child's school about how the child is behaving at school, and you get that to the pediatrician who will be assessing your child. And so also have all the information about your pregnancy history, your birth, the delivery history, because all those are important for the pediatrician when assessing your child. Because the pediatrician wants to know whether your child was born preterm or later. Pediatrician wants to know whether there were any substances that the child was exposed to during pregnancy, such as, sometimes mothers may not know they're pregnant and they may drink, or or not realize that the drinking might actually cause some difficulties to the child's brain and result in what we call fetal alcohol spectrum disorder. So, for some mothers who smoke or take other substances, some of these things can affect your child's brain development. And when the brain development is affected, that can result in differences in the way the child develops and some of the behaviors that we see. So, it's important that you give your pediatrician all that information from school, and it's good for you to remember your child's milestones when they did certain things. Think about how your child behaves when you go out for leisure, when you go out for, places where your child likes to go, things that your child likes to do, whether your child likes to play with other children or they would just like to play alone. So think about all those questions that the pediatrician will be asking you, so that you can provide them with enough information. And then they usually do their own bits of the assessment, which also includes sending some questionnaires to the school and yourselves, and for other people who know the child well. So if the child goes to an after school club, for example, getting information about the child's behavior there, and that getting it to your pediatrician who will then assess the child, be able to tell you whether the child meets a particular diagnosis or not. And even if they don't meet a diagnosis, the child could still be able to be supported using strategies. And your pediatrician will be able to communicate that with the school, will be able to signpost you to where to get training or
Mhm.
courses to help you. Because what part of the biggest thing is hurdle is knowing what is wrong with your child. From knowing what's wrong, then knowing how to support your child is the next thing.
Wow.
um and that is, so I've kind of covered the wide spectrum of neurodisability without neurodiversity, without going specifically into one. In future, if there's future need, we can then take each of those conditions
Wow.
because
Thank
and
you.
talk about them, because they present differently in girls and boys. So girls are frequently missed. because they don't present in the ways boys present. So the teachers would pick up the boys quickly because the boys are running around and, lively. The girls with these conditions many times might look completely fine,
Mhm.
and they might be sat in the class and may not show anything. But
Oh,
when they come home, the parents know that
oh,
this girl may have struggled to sit and do their work. They may not struggle with friendships. A lot of them have emotional symptoms like anxiety and depression. Some of them may have self-harming behaviors. So if you do not know how girls present, they can be missed. And we've had this a lot. And there are risk for the girls as well, because obviously the high mental health
yeah,
complications that can happen, and also things like you know uh, pregnancy. They're very vulnerable. They can um, be quite sexualized quite early. They might be very at risk of that because they can't they can't read the person, and they can, they're impulsive and they take decisions without really thinking about it. So there
oh,
are lots of implications for this, and there are different ways in which boys and girls present. So we can in future probably talk about ADHD, talk
sure.
about autism, and take it because each of those conditions requires people understanding the condition in detail, people understanding how to recognize it, people understanding how to support the children and the treatments that are available, and just having a better awareness and knowledge about the conditions.
That would be awesome. Do definitely want you to come back and then to discuss the different topics. So I guess you would have to come back a couple of times to do different topics.
No, I'm quite happy to do that.
All
I'm
right.
quite happy to do that because
Thank
I just think the more people are aware,
you.
then the easier it is to recognize. And like I said, walking this journey can be quite a very difficult and lonely road for parents.
Yeah.
And if they don't have the right support network, if they don't have the right people to talk to, if they don't have the right advice or where to look for advice, it can be a very lonely road
Yeah.
navigating those challenges.
Yes. Especially as a solo parent where you're kind of
Yeah.
doing everything by yourself.
Yes.
That could be a very tough road for the mother or the father, depending on who's
Yes.
got the
And
child.
definitely, I see lots of solo parents, um, you know, who are having to navigate this.
Yeah.
And sometimes, even those with two parents, sometimes it's one parent that's really doing more of the work.
Yeah.
It's very common that it's more of one parent, even in a two-parent household,
Yeah.
who is doing a lot of the navigation of supporting the child or young person.
Yeah. Well, thank you so much for being a guest today. I learned a lot.
Thank you,
A lot.
Jennifer.
Like I never realized that kids could actually go hide or just run around if it's noisy. Never thought of that.
Yeah, yeah.
So thank you so much.
No, thank you. Thank you for inviting me. And I look forward to coming to talk about, the other conditions as well.
Sure. That would be amazing. Thank you. All right.
All right. Take care.
You too.
Bye-bye.
Bye.
Bye. Bye.
All right, everyone. That was amazing podcast. That was Dr. Tyron. I will be definitely having her come back and talk about ADHD or the autism and how to recognize the symptoms. And also, like I said in the beginning, if you stay to the end, I will give you a free gift. So the gift is if you put in your email on my Stanstore, you'll get a free newsletter, and you'll be getting those every month. And if you would like to get more, I'll be putting up an ebook as well. And there's other newsletters that you can subscribe to. And there will be a cost for some of them, but you can choose which one you would like. And I will be definitely send it your way. So thank you again for being with me. We did take about 45 minutes on this, but that's okay. It was all worth it. So I will see you on the next podcast. So signing off for today, it's Jennifer.